Tara.
Hi.
Staskavage with
Nice to
Aramark.
meet you.
So nice to meet you too. Thank you so much for meeting with me today. I really appreciate it. How are you doing?
I'm doing well. How are you?
Good. Okay, before we start, I have to ask, is this a golden doodle?
Yes. Oh my goodness.
I love it. Okay, so I actually have one too. What's his name?
His name is Ty.
I love that.
Yes.
Where did you guys get him?
I got him from Dallas at Lone Star Doodles.
Okay, no, we actually got ours from Lone Star Doodles as well.
No way.
Yes,
Oh
how
my
was the
goodness.
process
That's
for y'all?
awesome.
It was great.
It was. The process was so smooth. They made it great, and
They
so it was wonderful.
And is he an F1?
He is an F1.
Okay.
Yes.
Oh my gosh, that's why we went with that, just because they're so much fluffier and more cute,
Yes.
you know?
I enjoy him so much.
Oh, good. I'm so glad. So, thank you again just for, sitting down with me. And I know that you're so busy as a hospital admin, and I obviously want to grant our time and stick to that 15-minute limit. But the first thing I want to do today, just before, going any further, is just being really upfront and asking you about Grace Clinic's current provider for the scrubs.
Okay, so honestly, we don't have one at the time.
Okay.
We don't have a current provider. All of our employees actually supply their own scrubs. So we've been looking. We've never looked into programs, but now I'm starting to kind of look after you reached out to me. Mm-hmm. And so, yeah, I would love to hear a little bit more about your sanitation process and control over.
Great. And about how many employees do you have that are purchasing your own
We
product?
have about 200 right now.
So a pretty substantial number.
Yes, I am.
And what are the main challenges that you're facing with these employees, providing their own scrubs?
Probably mainly the sanitation of the scrubs, just because they are bringing their own ones in. Because we don't really have any sort of monitoring to ensure the cleanliness of the scrubs when they come in. So I'm worried that we're not getting them properly cleaned.
Okay. And what are the quality expectations as far as, employees purchasing their own product?
We don't really have any specific quality expectations. We kind of let the employees choose for themselves because some of them like to prefer different brands over the others.
Right.
Depending on comfort and then also the price, really.
Right. And are there any color restrictions as far as, I know you mentioned before people were looking ununiformed. So do you have any color restrictions in place?
It truly depends on the department.
Okay.
For example, the surgery staff is teal blue.
Okay.
The OBGYN is royal blue, and then the transporters are more neutral coffee color. Mm-hmm. So we kind of style them according to the department.
And I know you mentioned before how important cleanliness is to you. So, how do you monitor that cleanliness? Are there, routine cleaning set in place just to ensure that sanitization?
No, we don't have any routine checks, which is very, very, it's a major concern for sure.
Right.
But when I hire them, I go over basic safety standards, and then we also have a training module that they go through. But that's really it.
Okay, so you're just, hoping that they use something as powerful as, OxyClean or Lysol.
Honestly, yes.
Okay, and is there any updates or, requirements for how often the scrubs are updated?
We don't require them to buy a new set at a specific time. Unless, of course, someone is coming in with holes or there's some kind of physical defect in it.
Okay.
So I've really given it to them to handle on their own.
And are you the sole decision maker when it comes to a new supplier?
I am regarding the health services, but I also work closely with the board of directors, and then also with our CEO, Brandy. So we have routine staff meetings and update the budget, etc. So.
Okay, so just to pause, a question that I find, just really important to ask when I'm sitting down with a potential buyer and, a potential future business partner is, just making sure that we align. So what do you look for when choosing a supplier? What's most important to you?
Honestly, just making sure we have someone dedicated to providing the quality and concern for our employees. Okay. And our patients as well. But I want someone who will value the company and really be committed to improving, together as a team. So I think the accessibility is major and trustworthiness as well.
I completely agree with you. Just making sure that partner is, trustworthy and also a strategic partner, that's so critical. So I would love to provide that for you. But with that in mind, what are the current issues that you're facing? The things that aren't meeting your needs.
Thanks for asking. So I'm actually really worried about our employees spreading germs. From home to around town after they leave work. They're everywhere in those scrubs, and they don't always follow procedure when they get there and just go straight to work from home. So, that's one of my concerns. And then another one is the spread of infections of the scrubs if they're not washed properly.
Okay, so, one of your biggest concerns is just, worrying about the quality of the cleanliness. Is that a distraction for you?
Yes, it is. it's a big distraction. We're honestly worried about the spread of germs and the infection. We've had a couple outbreaks lately, and it's not a good deal.
Right.
It's a lot of money. It's a lot of time. It's a lot of redoing things, and so it's not a good deal. So we need to really address those problems.
I hear you completely. And like you said, being the hospital admin, you have so many other responsibilities, things that are just requiring your full attention. The last thing you should be concerned about is the cleanliness of your staff scrubs. I mean, can we agree on that?
Yes.
So let me just introduce the company, just Aramark, who we are, what we stand for, and how we can provide that value and just remove that burden for you. So we actually started out as a very small vending company by two brothers back in the 1930s. They were just selling peanuts out of their truck.
Oh, wow.
But obviously, we've grown into a very passionate company now, and we're really just committed to providing that excellence in service and that customer quality. And we really take pride in what we do, and I can personally attest to that dedication just to getting it right. And at the end of the day, I want to be able to satisfy your specific needs. And so it's really exciting, actually, to hear your concerns, just because I know we can address them and create a solution together. But, if you're sitting about just in your office worrying about the cleanliness of your staff, you're not going to be dialed into your full duties. And being a hospital admin, you have so many things requiring your full attention. So I hate to say it, but you're actually right. So if your nurses are, using those scrubs and they're just using Tide or OxyClean, they're actually not getting rid of, those germs. And it's not providing that sanitization that you're looking for. So to be considered clean, your staff really needs to have 99.9% reduction, which I'm sure is in accordance with CDC guidelines. So, even while we're sitting here meeting, your nurses are currently walking around in this clinic in contaminated scrubs. So, we'll just imagine for a second, Nurse Sally, say this morning, she was running late, dropping the kids off at work, and she realized that she forgot to do the load of wash last night, so she throws on a dirty pair of scrubs. Do you think this is a risk that's happening daily at your hospital?
Honestly, yes. I wouldn't be surprised at all. And honestly, talking about it right now a little bit grosses me out.
Okay.
But
Well, honestly, me too. So I will tell you about a service that specifically addresses this concern for you.
Okay.
I actually brought a visual with us today.
Oh, awesome.
So this just lays out our entire process for you. And, clearly the first step will be picking a rental program or a purchasing program. We offer both.
Awesome.
But that just has a little bit more about that. But this is our process more in specific, and basically each week we start here and we pick up all of those soiled or the used scrubs from the hospital. We actually have them in sealed containers, and then we transfer them to our facility. And here is where our personnel will handle them, they'll sort them, and they begin the pre-washing process. And all of this is up to the OSHA requirements, just to make sure that it's completely sanitized. And we then use our science-based formula. It was actually developed by Ecolabs. And this just, provides a deeper micro-cleaning. And something that isn't listed there is our 4-step process. So this is called MicroVantage. And what this does is it not only sanitizes the product, but it actually separates the fibers. So it eliminates 99.9% of those pathogens. And that's just in the first step. So,
wow.
More powerful than OxyClean.
That is, it is.
You could say.
Oh, wow.
And then, we repackage it and we send it off to a multi-checking system just to ensure that quality inspection. And then we deliver it right back to your hospital door. So it's really just a hassle-free system for you guys, and it ensures, the reduced spread of infection. So do you have any questions about the process?
It seems pretty clear. It sounds like an awesome process.
Awesome. And I'll go ahead and leave this just for you, just so you have a solution to Nurse Sally.
Okay. Awesome.
And do you think that this, addresses that sanitation process?
Yes, ma'am. Definitely. It's great.
So looking more specifically, you mentioned how you have about 200 employees working, 4 times a week?
On average, yes.
Okay. So imagine, the reduced risk of, staffing your employees in clean scrubs to help them, get better and reduce that spread of infection. I actually brought a sample along with me.
Okay.
This is the product, just so you can see it for yourself.
Ooh.
And, I would love to customize a program with you, get your staff up to those cleanliness requirements.
Yes.
Do you want to go ahead and get started?
It sounds great, but right now I have to run it by my board of directors on this investment just because of they handle the money, they handle the major concerns. So I need to talk to them.
Okay, I completely understand where you're coming from with that. Before we move on to that concern, though, did we address your sanitization concerns?
Yes, definitely.
Okay, great. So, like I said, I would really love to help increase your sanitization and just reduce the spread of infection. But moving to your concern about the board, I actually would love to point out some research that you might find interesting. So I know the Center of Disease Control and Prevention, they did a study. They found that 1 in 25 patients are actually admitted every single day, the majority being in the ICU, because of diseases caught from hospital staff. So with that in mind, I understand, how important ROI is to the board specifically, as well as yourself. And so, I want us to think big picture now. So I want to tell you about how our scrubs can actually increase your ROI. Would that be beneficial?
Yes, definitely.
Okay, great. So we're going to step back again. Let's think big picture. So by providing your staff with our Aramark scrubs, not only are you reducing the infection that's going to be spread around, but you're actually going to be increasing your ROI.
Oh, awesome.
By doing so, by reducing these infections, in turn, you're going to be reducing the amount of money spent on, medical equipment for those patients, the food servicing costs, and just the medical drug expenses.
Okay.
And so, a common theme, this is a list of all the diseases that we actually protect against. One of them is actually C. diff. I know that's a major concern in hospitals, just because, one patient can have it, and then by the end of the week, 3 patients have it, right? And so just on average, C. diff, I know, costs hospitals about $34,000 per case, and it increases the patient's stay to about 11 days. So with that in mind, you're actually increasing the money that you're spending on hospital expenses, patient expenses, when you could be reducing the infections and reducing the amount of money that you're spending. So, by using Aramark, you're creating this domino effect of, reducing the spread of infection and increasing your ROI while, benefiting your stress-free environment, helping, reduce that load. But we can actually be saving you about 40% per case. And that's just, an estimate, not even looking at your numbers specifically. Okay. So,
wow, that sounds great.
Yeah, I would actually love to set up a meeting, with the board and with yourself, just to, help ease those concerns a little bit more. And I can bring more demos of the product, and I'll bring a personalized proposal. Of course, that's within the budget. But would that be beneficial?
Yes, absolutely. That would be perfect. Great. I know that the board of directors would feel a lot better with you coming and presenting. So.
Awesome. Would tomorrow work?
Tomorrow doesn't work because we have meetings all day, but would Wednesday work for you?
Wednesday is perfect.
How about 10 o'clock?
10 a.m. is great.
Okay, that's perfect.
Awesome. I'll go ahead and send you an invite. So 10 a.m. Wednesday?
Yes, ma'am.
All right, great. Well, thank you so much again for your time. I do really appreciate it. And I'll send you that invite, and I'll be looking forward to it.
All right, sounds
awesome.
good.
Have a great day.
You too.
Thank you.